Midnight Mental Talk with me, Leanne, and my co-host, the lovely Adrian.
Hello.
So, while I sit in Alberta and she sits in Nova Scotia, we're putting this video together for you today on postpartum depression. And while I gotta say it's a big issue, there are also many other forms of depression that go along with the pregnancy that you might not know about. You might have felt it, but you might have felt crazy. Here's Adrian with a list of whatever she has to throw at you.
All right. First, I'd like to actually say what the simple definition of postpartum depression is, and it's depression that's suffered by a mother following the child's birth, typically arising from the combination of hormonal changes, psychological adjustments, and adjustment to motherhood, and also the fatigue of taking care of a child.
Mm-hmm.
Myth number one. It will go away if I just tough it out or ignore it. The fact is, acknowledging the way you feel and getting help for postpartum depression will help speed your recovery. Myth number two, having postpartum depression means that I am a weak person. That's not at all the case. That's like any other depression or any other mental illness. You're not a weak person. It's just the way things are. And the fact for that is, a strong and intelligent woman can have PPD. Your doctor could have PPD for all you know. You did nothing wrong and you did not cause it. Myth number three. If I take medication for postpartum depression, I cannot breastfeed. Wrong. You can take medication for postpartum depression that are compatible with breastfeeding. You just have to check with your healthcare provider or your location or your consultant first. Myth number four. Postpartum depression can happen to me only in the first few months after birth. It can actually happen during pregnancy or any other time during your baby's first year.
Okay.
I think that comes with the fatigue and stuff.
Mm-hmm.
Myth number five, which is the last one that I have, it says because I did not have postpartum depression with my first baby, I probably will never have it. No. It's possible that maybe the next time around, because of the juggling of two children and the stress of that, you could potentially develop postpartum depression when you have your second child. I'm going to do a quick rundown of the symptoms. It's very similar to any other kind of form of depression. Baby blues symptoms are mood swings, anxiety, sadness, irritability, crying. I'm assuming that's like uncontrollable crying. Decreased concentration and trouble sleeping.
Mm-hmm.
So that happens, which they only last for a few days to a week or two.
Okay.
Which is good, so that's baby blues.
So not as serious.
Yeah, no, it just lasts for a while. It just lasts for like a week or two and then just subsides after a while.
Yeah.
But if it continues, then it goes on to being postpartum depression. It may appear to be baby blues at first. The symptoms include for postpartum depression is loss of appetite, insomnia, which to me is kind of entertaining because don't you usually lose sleep when you have a baby?
Yeah, you're up. If you're breastfeeding, you're definitely up multiple times a night. Even if you're not breastfeeding, if you have a colicky baby, you're also up multiple times a night. Or you could have a child that is like amazing and just sleeps right through the night from like month one.
Hey, I was one of those babies. Next symptoms are intense irritability and anger, overwhelming fatigue, which I'm sure comes with insomnia. You have lost interest in sex.
Well, gee.
I've never had a child, guys. I've never had a kid. But honestly, if I am going to give birth to roughly a 7-pound mini human, I really don't think I'm going to be interested in sex right away. But they don't say when this is. It could be like 6 months after the birth when you're all healed. So you might just completely lost interest in the sex life altogether. You lack joy in life, feelings of shame, guilt, or inadequacy. You have severe mood swings. You have difficulty bonding with your baby. You withdraw from friends and family. You have thoughts of harming yourself or your baby. And if this goes untreated, postpartum depression may last for many months or even longer. And there's a question after that, like, when should you see your doctor? Well, right away. Especially if you're having thoughts of hurting yourself or your child, it's really important to go see your doctor right away and explain to him or her what's going on, because the sooner you talk about it, the quicker you can get back to yourself, who you are, and also back to a routine with your baby and your family.
I personally think it's important to seek help for that early on, because you can end up in abrupt fights with your spouse, and, you know, that's the last thing you want to be doing around a new baby. If you're in a bad enough state, you know, something bad could happen. Like, you just never know. Either you go suicidal, or you go apeshit on your husband, or your husband goes apeshit on you, or the baby gets affected, you know? Like, there's an endless possibility of scenarios if the postpartum depression is bad enough and untreated. So
Yes.
please, anybody out there who has a newborn at home and is watching this video saying, holy crap, that's me, call your family doctor.